Okay, thank you. Thank you so much. It was very kind of you. Good morning, everybody. How are you doing? Well, I don't want to sound too morbid or anything like that, but it's kind of funny. You know, there's a lot of folks who've known me for a lot of years, and you know, I was almost killed in an industrial accident back in 1988, where my arm was stuck between two rollers going about 30 mile an hour. These rollers are about that big around. And it was one of those deals that I was in this thing doing what they would call in strongman a Viking hold. I was doing a real life Viking hold for 8 minutes while this amount of space was actually encroaching upon my body and rubbing my body raw. So happens I was in it for 8 minutes, and fortunately for me, I was able to go ahead and get out. And went to the hospital right away, suffered a lot of damage. In fact, they were going to cut my arm off at the elbow. Funny thing is, though, is that as time was going on, I hadn't really used that as an excuse to not do anything. I've been able to go ahead and successfully do a lot of exercise. I've competed in bodybuilding events. I've actually won bodybuilding events. I've competed, you know, over the years with that. I was one of the first handicapped strongman athletes on the planet, and now we actually have a handicapped strongman event, which is actually internationally recognized these days. And you know, I've done a lot of crazy things. You know, I used to have a 500-pound deadlift even with a bad arm and no lats, and I did that deadlift for 20 reps. 2,000-pound leg presses, like you see in the magazines, used to do that. So you know, and I can still tell the story. I can stand up afterwards. So it's been an interesting journey. But then when I went to chiropractic college, that was really odd because I didn't have the flexibility to do certain things. So there was a gentleman by the name of Dr. Frogley that was there, who was really instrumental in changing my perspective on chiropractic and how to do it, how to get those applications. And so I guess, you know, one day I'd like to be known as kind of like he was. I'd like to be known as the wizard, trying to figure out how to make things happen for you doctors, you know, in the future. And so I've come up with some really interesting things, and then of course we'll go ahead and get into the meat of how that all happened as we go along. So if you would, just bear with me as we progress through this, and I'm excited to have you guys here. Hey, listen, you know, just kind of get an idea of what my audience is like. How many of you guys have been in chiropractic 5 years or more? Or actually, 5 years. We'll say 5 years first. 5 years? 10 years? 15 years? 20 years? We got docs in here 30 years? And I bet we got somebody who's been here about 40 plus years, don't we? Isn't that great? Now, here's the thing that I would love for you guys all to do, and this is something that I think, you know, is being lost in the profession as a whole. You see those doctors who've been in there 20 years or more? Ask them questions. Don't do yourself a favor. Don't be an island. Do talk to the other doctors. Get engaged with those doctors. Pick their brain. There's a lot of knowledge that these guys have. And unfortunately, with people, as we've seen, you know, the greats like, you know, Sid Williams and the like, you know, that have been around for such a long time, and they're all gone. And slowly, these guys are leaving our presence, and they're taking a lot of incredible knowledge, such as Barge did when he passed away. So anyway, just you know, reach out. So anyway, listen. What I want to do is we'll go ahead and we'll start right out of the gate here. And we'll take a look here. You go ahead and look here. 50 athletes were evaluated for agility, balance, reaction time, kinesthetic, proprioception, and power. The control group in this study improved 4.5% in 6 weeks. The adjusted group improved 10.6 or 2.4 times greater than the control group. The adjusted group improved another 6.1% after an additional 6 weeks of spinal adjustments. So I would say it's very clear that the work that we as chiropractors are doing has its place not only in the lives of those people that we treat on a regular basis, but also those individuals that are, you know, focused on athletics. The other thing too, there was another study. I was in a seminar here just this last weekend, and do you realize that there is a study, and I can't give it to you, but I was told about it this weekend by the presenter, that there's a study out there that shows that there is no maximum benefit for chiropractic. In other words, you just keep getting better and better and better. So for me, I think that there says there's definite reason for maintenance treatment, because you just keep getting better. And you probably know that since you've been in it for about 40 plus years, right? So, there we go. All right, so treatment through the chiropractic adjustment aids in force production and balance for driving power in sports, as well as normal daily life. The spinal column and feet contain by far the greatest amount of receptors, sending information to the brain, according to Guyton. Ankle treatments can and do open up physiological blocks, such as compartment syndromes, as seen with shin splints. But you should also take note that it reduces the irritation on the medial collateral ligament, which often can be slow in its healing processes, especially after an injury. Now, it's kind of fascinating. It's one of those things that when you go ahead and you get in there and you go ahead and you address the ankle, how important it is when you go ahead and you address the entire kinetic chain. What we find is a lot of times as we go through the process where we end up most of the time focusing on the pelvic dynamics, maybe the upper trochanter and things along those lines, the patient get off the table and still have some hip pain. And maybe some of you guys have seen that, especially you guys have been 5 years or less. Well, here's a little clinical pearl. You go ahead and you take a look at that ankle in through there, you'd be amazed what that'll do. IT band tightness will often go ahead and go away. A lot of times compartment syndrome, we see this with runners so often. You go ahead and you open up that talus, and literally within minutes, you can see the swelling go away in the front of that area for shin splints. It's pretty fascinating. And it's the anterior tibial muscle right in through there. But also, you know, with the IT band, and we just had somebody in the office just the other day. You know, we got everything done, everything looked great. Then we went ahead and we hit that ankle. And you know what? He went from, you know, with just the most of the adjustments that we did, I think he went down to maybe a 4. And then by the time we went ahead and we just blasted his ankle, he had no pain at all, which is kind of incredible if you think about it. Makes you appear to be somewhat magical. The other thing too, in regards to the adjustment of the ankle, as we're kind of touching base on this, is that ankle sprains have been found to heal much better. We see that in the office. And of course, you know, if you work with any athletes whatsoever, especially like, we'll say volleyball players are always spraining those daggum ankles. And they go ahead and they put them in, you know, things like, what do they call them? Active, you guys, can you help me with that? Active, what do they call them? Active ankles, all right, thank you. So you got active ankles, but you know what? I caution people when they go ahead and they start taking out joint motion. You remember, it's all about kinetic chain, right? So all your joints are supposed to be movable in order to go ahead and maximize your function. And of course, you know, as indicated right through here, you know, dynamic stability requires more than adequate force generated by the muscles, but that force must be appropriately coordinated at that precise point in every movement. Normal proprioception, which a lot of times come from the feet, is essential for this muscular coordination. So if you go ahead and you lock out that ankle in through there, you actually are setting the next joint into a problematic state, right? So in other words, the next joint would be the knee. And of course, if you have, you know, which we often have with young ladies with their development, Q angles increasing, which is basically the angle to the knee. And if you don't know that, look it up because it is very important. But a lot of times what you'll see with the high Q angle, and of course flat feet a lot of times too, what you'll find is that you'll have MCL, ACL, and then also medial meniscus damage that occurs quite often with those. So those stress points are very important. So it's also very important to make sure that those ankles are cleared. Now, again, you know, it's all dependent upon the severity of what's going on in regards to the severity of that injury. Okay, so we've had athletes that in strongman, for example, would be carrying, you know, 800, 900 pound yoke and go ahead and run with that yoke on their shoulders. And sometimes their foot placement isn't quite right where it needs to be. And I've actually seen those ankles literally with 900 pounds roll in through here. And within minutes, we were able to go ahead and get in there and adjust it right away. And of course, you know, if you think about how the ankle works and how ligaments and things like that heal, if you don't have the bones back in place in those areas, which are mostly ligament, right? What can happen is that ligament will heal at an elongated state. Is it any wonder that we have so many people that once they sprain an ankle, they continue to sprain it? So getting together with your sports med orthopedist and or your local athletic trainer, I think it's extremely important to go ahead and add that into the mix. Wouldn't you agree? Heck yeah. All right, so let's go ahead and this is something else I think is very important that so often is missed. Since the body's full of afferent and efferent neurological feedback systems, Afferent, receive. Efferent, act. It is important not only to identify potential damaged anatomy through proper radiological evaluations, but also to front-load expectations for the athletes. For those with scoliosis or bilateral curves, overhead pressing, for example, may be a problem, resulting in one of three types of thoracic outlet syndrome. It could be either neurovascular or what they call nonspecific. It could also likely be sternocostal, costoclavicular, and or vertebrocostal syndromes, which can and do often overlap complicated clinical identification and or separation of the diagnosis. Very often what I found is that you can actually have one of the three TOS variations in concert with sternocostal syndrome or vertebrocostal syndrome. So that in itself could be a problem. So for this reason, which there are many, and this may be contrary to a lot of our friends who profess that motion palpation methodologies are sufficient for athletic care, a set of radiographs can, and in my experience, does clarify the athlete's issues according to, according to what I'm seeing, and it definitely allows the chiropractor to dial in the appropriate proper diagnosis for the athletes for premier performance. And I believe, that's what we're in here to do for the most part, is we're trying to figure out ways to go ahead and enhance our athletes' performance. So think about this. As you go ahead and you read the slide, joint receptors are fundamental to control of human motion and movement. Research shows that position and movement sense are impaired in the presence of joint damage or arthritic changes. So in other words, the signals are starting to get crossed as there becomes more and more damage. And that makes a lot of sense. It makes also a lot of sense when your patient comes in and they say, I can feel the rain coming in. And those of us who are after, a little older than 50 plus seem to be a little bit more susceptible. And a lot of that's due to the damage. But if you go and you look at that, you have irritation in the joint itself. The joint and the capsule is a barometric pressure gauge. So it makes perfect sense that you can go ahead and you feel those things. The interesting thing that we often forget, I believe, is that the weight of a dime is all it takes to go ahead and change the function of a nerve. Okay? So if you're standing, that's more than the weight of a dime already, isn't it? And at the same time, how many of us can take a dime out of our pocket, put it in our hand, and really, really feel that dime? It's not a whole lot, is it? So it's not a whole lot of weight. So there can be a lot of things that are affecting your body. Stress, for example, can obviously affect cortisol production in your body, right? So it's not that hard of a stretch to go ahead and consider what I'm talking about right now. Now let's go ahead and look at the brain-body connection. As with the previous slide, discussion involving those with variables from the desired perfectly postured spine may have a negative influence in rib joints, which could cause weakness variables not only during pressing motions, but also complexities during breathing and trunk motion, which can all hinder the athlete's performance. The deviations from normal posture and subsequent neurogenic sensory alterations is described in this slide right up here, which indicates a change in reactivity and can and do change the flow of motion throughout the entire kinetic system of the athlete's body. Again, appropriate radiographic studies, contrary to the new ACA stance on them, are proved not only to be appropriate, but necessary, which fits into the current position of the International Chiropractors Association. You take a look up there, and again, just kind of review it. The brain is driven by information it receives from the mechanoreceptors and the proprioceptors, which are nerve receptors, in the joints and the muscles, amongst other things. The spinal column and feet, which we talked about a moment ago, contain by far the greatest amount of receptors sending information to the brain. The upper neck contains the greatest amount of these receptors in the spine. And about 10-15 years ago, there was actually a study that also indicated that through stimulation of the cervical spine, you actually see a boost in your immunity as well, just as a side note. Joints with abnormal alignment, as we talked about in the previous slide, and motion send signals to the brain that affect the brain, not only reducing the capacity for other brain functions, but also causing an abnormal response to the muscles that control movement and coordination of the body. Interesting thing is that many of us have used Guyton, the textbook Guyton, and we still, in many of the schools, still use that today. So, mobility. Anybody heard of mobility? I like saying mobility. So, Let's take a look here. Ask any CrossFit athletes, and they'll preach the importance of mobility. Here's a quick rundown of mobility features and the relation to certain strength-focused movements. Unfortunately, it's been my experience that those in the CrossFit arena often feel that their mobility self-treatments are equivalent to that of the chiropractic adjustments, which we all know couldn't be further from the truth. The other issues I've noticed is that they don't or just refuse to understand spinal variations, pelvic dysfunctions, anatomical short legs, etc., all if not realized through proper evaluation techniques from a competent chiropractor, will and often do result in a very short career in that sport due to the neck and or back and spinal pain. Other issues that I've seen involve chronic soft tissue edema and of course the typical knee, wrist, elbow symptoms that plague the sport. And I'm going to tell you what, from a business model, I'm thinking that the smart chiropractors are the one that own their own CrossFit centers, don't you? That's sort of like shooting fish in a barrel, just a little bit. Wouldn't you agree? So, I don't have one, by the way. Let's take a look in through here. So go ahead and take a look at the squat. And we can go ahead and we can bring somebody up here, but you can, I think basically in practice every day, you're very familiar with the fact that a lot of your patients don't move appropriately. The older they get, the less appropriate the motion is so often. Unless they're a big yoga fan, right? But anyway, if you go ahead and take a look at the squat, you take a look at ankle dorsiflexion. We're back to ankle again just a little bit. Thoracic spine mobility, hip mobility, and that's going to affect the core anterior strength. And that's just in the squat. Go ahead and take a look at the bench. You need upper back strength, scapular stability. You need anterior hip mobility for the bench. You don't even think about that, right? And that also allows you to go ahead and have more hip stability. And of course, shoulder stability. The interesting thing about, when a lot of people go ahead and do bench presses, is if they go ahead and they put their head back onto that bench and they push really, really hard. Others will go ahead and bring their chin up and then go ahead and push off of the T1 area. Significance of that is really interesting, and so many of us kind of get that. If you go and you look at the serratus for shoulder stability, which, obviously if it's weak, that's going to cause winging of the scapula, right? Well, if you go ahead and you consider the fact that that T1 area is where the long thoracic nerve comes off, what are we affecting? We're affecting the serratus again. So, shoulder stability is very important. Also, placement, if you will, while you're doing the exercise is also extremely important. We had an athlete that actually has recently come in, and he's getting into a different kind of exercise program. And I think, the one thing, and the next slide will touch base on this here just a little bit, but we need to also accept, if you will, some anatomical restrictions on some of our people. He was doing the standard bench press, and unfortunately ended up with a shoulder injury. Well, most people, one, don't do the bench press correctly to begin with. Two, if you go ahead and take into consideration those anatomical variations, or maybe even had a subluxation at the time he did the bench press, that changed the dynamic of movement, okay? You don't necessarily have to go ahead and go completely into the chest area to go ahead and get a chest workout. And I think some of our exercise experts could attest to that as well. So with that being said, sometimes you go ahead and do variations where your starting point and your end point are the same. There's a technique called rack deads and rack bench presses and rack presses as a whole, okay? And so basically what you do is you go ahead and you set the starting point where it's anatomically best for that athlete, and then they go ahead and that's their start and stop. They also at the same time have a dead stop, so you're going to have a lot more muscle recruitment when you do that. But at the same time, to go ahead and make it to the point, you're not overstressing the joint and that patient's anatomy to go ahead and accomplish a lift, so that way it's going to be a lot more safer for them long term. So anyway, that's just one thought. Thoracic spine mobility is important for the deadlift, of course hip mobility, hamstring sensibility as well. But another thing that a lot of people don't realize that when you go ahead and you do deadlifts, and especially when you get into heavier weights, you have pec activation as well. So in other words, that chest is going to be firing like crazy. So you'll see that when you have somebody who maybe have an upper extremity or shoulder injury, and they go ahead and they get in there and they say, well, I'll just go ahead and do all lower stuff and I'll go ahead and grab a deadlift bar. Well, next thing you know, they're screaming because that pec is hurting too. So kind of interesting stuff. OHP, I touch base on OHP a lot. OHP is basically overhead pressing. This is pretty important stuff when you go ahead and consider that. And so we'll kind of, hammer through a little bit more and as far as details are concerned. But, thoracic spine mobility, shoulder stability, shoulder mobility, and core stability. All mobility benefits, of course. So, if you go ahead and you take into consideration what Al Cavado talks about, the expertise, if you will, of a competent chiropractic doctor can't be more valuable even when it comes to ensuring that even stretching mobility work won't compromise the athlete, either in the short or long term.